Thank you everyone for joining us today. We're here to stand up to the sabotage that we see coming from the Trump administration. We've got a great lineup of speakers for you. First, we welcome our congressman from here in Central Phoenix in the 7th District, Congressman Ruben Gallego.
Thank you. It's unfortunate that I have to be having this press conference to be talking about the fact that a president has purposely sabotaged our healthcare system, a president who has openly admitted that his goal is to undermine the healthcare of millions of Americans and potentially put their health at risk. And for us to have to, encourage a Congress to not participate in harming their fellow citizens is even sadder. Let's be clear. The Affordable Health Care Act provided very necessary assistance to many Americans so they could buy an affordable and good coverage when it came to their health care. What we have now is Trump Care 100%. He has destroyed what we understand as Affordable Health Care Act. He has caused the increase in premiums across the country, which will be on average 30%. By next year, it is estimated by the Congressional Budget Office that will be 1 million people without health insurance. Right? What a heartless administration we have, that they are willing to cut premiums, cut some support for people to buy health insurance who are trying to be responsible for the sole purpose of essentially destroying the legacy of President Obama. Not to replace it with something better, not to save money, because this doesn't actually save money in the end, according to all estimates, but just out of pure spite. And the fact that you have Republican members of Congress who consider themselves leaders in this country, such as Martha McSally, and for them to be silent and not do anything is really a dereliction of their duty. What we will see if this is allowed to happen is you will see one of the largest tax increases for middle-class families that will be found through premiums. While the Republican Congress is working on a way to make sure that millionaires and billionaires and corporations pay less taxes, pay less of their fair share in terms of keeping our government open and the necessary services, and they will be worried more about those people that don't need tax cuts versus the middle class. Right now, they're going to have to pay higher premiums, essentially higher taxes because of Trump and the Republicans' dereliction of duty to keep this president in check. So my ask is simple. If you consider yourself a fiscal conservative, a Republican that cares about deficits, a Republican that cares about stable markets, stable insurance markets, and who has complained for many years about Obamacare, quote-unquote, raising premiums, you should be against this move that Trump has just done, because he is doing exactly what you accused the Affordable Health Care of doing for many years. He is creating destabilization in the markets, is going to create a situation where millions of people are going to go without health insurance, and is going to raise premiums for unnecessarily raised premiums for millions of Americans, while at the same time not providing better coverage for Arizonans and Americans in general. To summarize, at the end of the day, we have moved from the Affordable Health Care Act, which brought 30 million more Americans health insurance, good coverage, an end to pre-existing conditions, an end to lifetime caps, to Trump Care, which is going to bring back lifetime caps, no longer banning pre-existing conditions, and rising and uncontrollable premiums with more people without health insurance. That is what we just switched to. There is no victory here. The only victory is in Trump's mind, because he gets to revoke a piece of Obama's legacy. But above all, the biggest loser is your everyday American citizen, working class person, who now is going to end up paying, because of Trump's ego, more in premiums. So with that, I will turn it over to Jody Liggett, my good friend and compatriot in battle, and we will take questions afterwards. Thank you, Jody.
Thank you, Congressman. My name is Jody Liggett. I'm the Vice President of External Affairs for Planned Parenthood Arizona. And we're here today to talk about the latest action of the Trump administration. It seems that every opportunity Trump has taken aim at healthcare, particularly at undermining women's healthcare. Just last week, the administration targeted birth control coverage for 62 million women. Before that, it was focused on gutting programs intended to help people enroll in health insurance. Women and people around the country are outraged at these actions and will continue to stand up against these attacks. The executive order we're talking about would expand the use of association health plans, which allow small businesses and trade associations to band together, which sounds like a good thing, but really it would enable them to avoid important consumer protections that exist to help people compare apples to apples plans and to know that they're getting real insurance coverage when they purchase insurance. These association health plans would carve out coverage for critical care, including maternity and newborn care, prescription drugs, emergency care, potentially hospital stays, physical therapy, lab work, chronic disease management, even pediatric care for kids. If you're carving those things out of healthcare, what do you have left? I'm betting it won't resemble healthcare or health insurance at all. Women benefit from the inclusion of these standard benefit requirements in regular health insurance, unlike these association plans. For instance, this order puts maternity coverage for approximately 13 million women at risk. Without insurance, a normal birth can cost $30,000 on a cash basis, and a C-section can cost $50,000 in out-of-pocket costs. This order would also allow insurers to sell bare-bones health plans for longer periods, and they may not have to cover basic health care services, as we mentioned, like birth care, maternity care, and birth control. Each year, a growing number of women have been able to access the birth control that meet their needs without cost barriers under the ACA. Women using birth control pills saved an average of $255 a year, and women using IUDs saved an average of $248 as a result of just the birth control benefit. As we keep mentioning, these plans generally do not have to cover pre-existing conditions. Failing to cover people with pre-existing conditions will harm millions of individuals, and women in particular. In fact, pregnancy could be considered a pre-existing condition with a steep price for new and expectant moms. Prior to the ACA, health insurers had the ability to deny women coverage, charge them more, or refuse to cover certain services because they had a pre-existing condition, including having been pregnant or being a breast cancer survivor. That's wrong, and the ACA changed that. Under some of the failed ACA repeal bills, studies found that the ability to charge people more for pre-existing conditions led to steep declines in coverage. Under the failed ACA repeal bill, studies found that insurers were charging women who have breast cancer $28,000 more on an average annual basis for coverage, and a woman who has been pregnant an additional $17,000 on average per year. President Trump's new executive order is sabotage, plain and simple, and women, above all, will pay the price. This action will almost certainly result in lower quality, more expensive plans for the American people, and will limit access to vital health services such as maternity care and birth control. We must reverse this course of action. This will harm real people across the country. Planned Parenthood stands strong with our allies against this latest Trump initiative. Thank you.
Thank you, Jody. Our last speaker before we open up for questions is both a cancer survivor and a person who buys her health insurance on the individual marketplace. Her name is Tony Bannister. She lives here in Phoenix. So she's going to come on up. And anybody holding a sign, why don't we stand with Tony and stand behind her and let her know that we've got her back.
Hi, my name is Tony Bannister, and I am a cancer and a breast, I'm a colon cancer and a breast cancer survivor. Stage 3 on both of them, and it is only by the grace of God that I'm standing here today. In 2001, in November of 2001, I found out that I had colon cancer, and in December of 2001, I found out I had breast cancer, and I was a 44-year-old mother, a single mother of two, and a business owner. It was a very difficult time. I went through chemotherapy, went through radiation, more chemotherapy, and a lot of surgeries, and I'm standing here today. I'm also in the construction industry, and when the construction industry tanked in 2009, I had to make out the last check to my health insurance company, and I did not know if I'd be able to get health insurance again or not. I was 10 years out from having cancer and was still calling and trying to find out if I could get health insurance, and it was very, very expensive. I prayed and prayed that President Obama would get the ACA through so that people with pre-existing conditions would be able to get affordable health care. And he managed to do that. I don't care how he did it. I'm just glad he did it. So the minute that the marketplace opened and I was able to get health care, I was all over it. Then I was able to go back, go to my oncologist, start with my blood work again, start with yearly colonoscopy, start with mammograms again, all of which I had gone without for about 3 years, which is a scary thing for a cancer survivor, to not do follow-up testing. What I found out was that I had genetic testing. I have 2 cancer genes. If it were not for the ACA, and if it were not for me being able to get onto the marketplace and get affordable health care, and affordable, when I say affordable, I mean that I received a subsidy which allowed me to get health care, okay? If it weren't for the subsidy, it would not have been affordable. So that allowed me to get testing, genetic testing, which showed that I have 2 cancer genes, which not only helped me, but it helped my sisters as well. So then my sisters were tested. One had it, one didn't. My sister who had the genetic factor, her daughter was tested, it also has it. If we do away with the pre-existing law, it could completely decimate my family. My father, about 1.5 years ago, died partly related to skin cancer that he had. I haven't had my 2 sons tested who need to be tested, primarily because I don't know what's going to happen with the law. With regards to the marketplace and making health insurance affordable for everybody, it went from last year, the premium without the subsidy was almost $700 for myself and my son, with about $1,000 deductible per. Then, this year, it jumped to $1,200 and a $2,000 deductible per. That, in and of itself, is $17,000 that I would have had to somehow come up with this last year to cover for premium, yearly premium, and my total out-of-pocket expenses. I have met my total out-of-pocket expenses because I've had surgeries this last year. Only because I have insurance am I able to get the surgeries that I need in order to remove the parts that need to be removed so that I mitigate my chances of having cancer again. So I cannot, for the life of me, wrap my mind around people who think that health insurance should be an optional right, some kind of present that you get because you have the money, right? France is able to do this, Italy's able to do this, Japan does it, China does it. We're the United States of America. We're supposed to be setting an example. We are not. We're setting an example, but it's not the right example, okay? It's an example of we don't care about our people, all right? We have, this year in the marketplace, there was one health insurance company that was in the marketplace. One. So that you know, that one health insurance company, last year, their CEO took home $21 million. Okay, that doesn't include the deferred compensations that he has deferred out, okay? The health insurance companies are making billions of dollars. And if you are fortunate enough to have purchased stock 4 years ago, God bless you, because you've made a good return. If you weren't, well, then you're like the rest of us who are coming in here and breathing in between the craziness that's going on in Washington, okay? When you come up here and you talk about it and you have an expectation that your government is actually going to do the right thing for the people that it's supposed to take care of and represent, and then it doesn't, it's very discouraging, very, very discouraging. So you come, stuff doesn't pass, you breathe, and then they go at it again, and then you hold your breath again. It's not a good cycle to live in. It's just not. I don't understand this country anymore. I served this country, its military, as a guards person. And it's very, very, very disheartening. We need to have, we need to get the health insurance companies out of it. We need to be able to do the right thing. We need to be able to offer affordable health care. I want to hear people start talking about what the real problem is, because nobody's talking about the problem. Healthcare isn't healthcare. Healthcare is all of these little portions, okay, different entities that make up healthcare. In there lies the problem. In there is what we need to address, okay? So I am hoping and praying that somebody will come to their senses and quit doing this schoolyard nonsense about tit for tat kind of thing, and actually start acting like adults and acting as if you actually care about the people in the United States. Thanks.
Thank you, Tony. Journalists, any questions?
Sure. Yeah, no problem. Okay, I got this, guys. Thank you. In the shade. Oh. Sorry. Got it. Okay, who had the question?
Yes, sir. We just want to ask you really quick. So how exactly would those cuts to subsidies kind of affect Arizona? Can you just give us like a quick detail about that?
Quick, I'll try to be quick details. Look, the insurers that are on the insurance market anticipated that the president wouldn't be as irresponsible as what he is doing, and therefore did not assume that the premiums would be paid out. So they adjusted their costs and their services basically based on this idea that the president was going to continue with the premiums. Now, what's going to happen eventually is when these premiums are not paid out, they're going to readjust and essentially start raising the premiums, and they're going to raise the premiums essentially based on your risk factor. So if you are somebody, for example, has cancer, you're going to end up paying more, not less. Secondarily, with the executive order the president started, where he basically has created these Trumpian sham insurance coverages, it's also going to create a sucking out of the market. So what's going to happen is people that are very healthy, so I'm a young person that is relatively healthy, and if I don't want to pay into higher coverage, I'm going to look for the bare minimum coverage. So all these healthy young people are going to leave, and it's going to create another situation where these people that are within these insurance markets are going to see their premiums rise. So the president has deliberately did these two steps to basically undermine the insurance markets. And he's done it, and it's going to be at the detriment to people that have, exactly like this young lady here said, pre-existing conditions. And he doesn't care, because this is all about him taking away Obama's legacy. Instead of trying to improve the system, instead of trying to work in a bipartisan manner, all he's going to do is basically cause millions of Americans to lose health insurance, millions of Americans to go into debt, and potentially thousands of them dying because of lack of insurance.
And how will this specifically affect Arizonans? Are there a lot of Arizonans that pay a lot of subsidies, or kind of can you focus it more into the state level?
Okay, so take everything I said and add Arizona to it, and that's basically it.
Perfect. Are there a lot of people in Arizona who kind of rely on those subsidies?
Yes, hundreds of thousands of Arizonans rely on that subsidy.
And if you were able to kind of do away with Trump, what would you want to see in a healthcare? What type of healthcare system would you want to see?
So, okay. Look, ideally what you would have is you would have a healthcare system where everyone's covered, and that way that brings down the overall healthcare costs, and they're covered from birth to death. And what that happens is that brings down the overall lifetime costs for healthcare coverage, right? Instead of what happens now, people end up getting healthcare coverage when they need it, or it's too late, and that's why healthcare coverage ends up being more expensive in the long run. If you can't do that, which is something what we understand as Medicare for all or single payer, you would try to create a system that we currently had under the Affordable Health Care Act, where more people would be buying into a health insurance market, so that we have a healthy mix of healthy people that really don't need health insurance, but you're taking care of them now, and people that do need health insurance, and you're overall sharing the overall cost in the insurance markets, and you bring down the cost because you're sharing it across the board. So in a simple manner, that's how you would do it. You're not going to do that without writing a full dissertation on healthcare policy.
All right, perfect.
Thank you.
That's it. Thank you.